All right, blood vessels. Here we go. So, one of the first things we need to understand is that blood vessels form this closed circuit, meaning it is a defined pathway that blood has to follow all the way through your body. Blood is just not leaking out all throughout your body. It is contained within either the arteries or the veins, depending on just where it's at in the body. So it's a closed pathway that just constantly circulates. Our arteries are going to carry blood away from the heart after it's been oxygenated. Veins are carrying deoxygenated blood back to the heart so we can reoxygenate it and get it back out into the system. Now, if we look at the artery walls, most of them are going to have 3 layers, and we call each of these layers tunics. So every layer to an artery wall is called a tunic. So the tunica interna is going to be the innermost layer of our artery wall, and it's formed from a single layer of simple squamous epithelium. So it's nice and thin, so we can easily move things if we need to across it. It also provides a smooth surface for the flow of blood and platelets, so things are not getting snagged up as we are pushing blood through the system. Then we have our tunica media. This is going to be our middle layer. This is the biggest layer, and it is smooth muscle, of course. So our brain is kind of controlling that in the background. And we've got a thick layer of connective tissue to give it a tough elasticity, so it's nice and durable. And then the outermost layer is the tunica externa, and we're primarily going to use that to help anchor the artery in place to the surrounding tissues so it's not getting just moved around as we move our muscles. So here we can see a picture. We want to know this picture for the practical exam. The tunica interna, nice and thin, that simple single layer of simple squamous. And then in the middle, we can see the thickest layer of my tunica media. That's going to be the muscle layer, essentially. And then the tunica externa, the anchoring layer on the outside. So vessel diameter. Branches of the autonomic nervous system innervate smooth muscle in the artery walls. So remember, autonomic, we think automatic. So this is the stuff that your brain is doing subconsciously. Vasomotor fibers can cause the smooth muscle to contract. We refer to this as vasoconstriction. Vasoconstriction is where we're going to make the vessel smaller in diameter. So we close off those vessels a little bit. We shrink it in. Excuse me. And when we get these same muscle fibers to relax and expand, we refer to this as vasodilation. So vasoconstriction, the vessel gets smaller. Vasodilation, it's going to get larger, wider, so we can move more blood through that vessel. And both of these will, of course, impact blood pressure. If we're constricting the vessel, we're going to increase the blood pressure because we're just measuring the pressure against the vessel wall itself. So arteries, muscular and elastic tubes that transport blood under the high pressure exerted by the heart. So the arteries, the big arteries closest to the heart, we refer to as elastic arteries, and that's because they have to be able to accommodate that surge of blood that gets expelled from the heart with each contraction. So these arteries have to have a little elasticity to them so they can expand to accept all of that blood from the heart with each contraction. Then we have muscular arteries, just medium size. And with these guys, we're going to have a more tunica media. That muscle layer is going to be more pronounced, which is going to allow for better vasoconstriction or better vasodilation capabilities. Anastomoses, this is just an alternative route of blood through collateral circulation. So we've just kind of got a backup plan with an anastomoses to get blood to particular regions. We have another way of getting there, an alternative route. So we find this in things like our brain and some of the big joints like the knees, our hands and wrists. I should say our wrist and our ankles, kind of in that region. We have some anastomoses. Arterioles, these are just small arteries. This is kind of the segue between arteries and capillaries. So this is where our arteries get smaller. And then capillaries, of course, are the smallest of the blood vessels. Their walls, again, are simple squamous. epithelium for the rapid transfer of substances, because we know we've got to move oxygen and carbon dioxide into and out of the bloodstream as we deliver it to the cells and pick up their waste products. And these guys are going to connect to a venule on the other side of things. So venules are just a very small vein. So in between the capillaries and the venules that we just looked at is going to be the cell. So we go artery, arterioles, capillaries, the cell, and then at the cell we're going to get rid of our oxygen, we're going to pick up the carbon dioxide, and now we're going to work back towards the heart with this carbon dioxide and the deoxygenated blood. And the first step in that process back to the heart is through venules. So venules are kind of like the capillaries on the venous side of our vascular system. Now, as we get closer towards the heart, our venules become bigger, and then we refer to them as veins. So they carry oxygen, pour blood back to the heart. Thinner walls than our artery, less smooth muscle, so they are less elastic. Their lumens, though, have a greater diameter. And something really interesting about veins is they also have flap-like valves, semilunar valves in particular, like our heart does, to ensure this one-way flow of blood. So we just really have to push the blood up through the next vein, or through the next valve, I should say, in these veins to get it a little bit closer to the heart. So with each contraction, we're pushing more blood through just the next valve, and then the valve after that, as we work our way back. And our veins function as blood reservoirs in times of blood loss. So we can lose up to 25% of our blood and still be okay, because our veins can vasoconstrict, get smaller, and then we're still able to keep that closed circuit of blood, hopefully if we get wherever we're bleeding from, patched up. So just some pictures to kind of show you how the valves work in our venous system. Blood gets pumped through, and then as the heart is resting, getting ready for its next contraction, those valves close so blood cannot flow back the other way. And that just ensures that one-way flow. So venous return is just something that our body has adapted to through evolution as we've turned and stood upright and now walk upright against gravity. It makes it a little bit harder to get blood back to our heart. So our body has come up with a couple of ways to help that process. The first is a skeletal muscle pump. And this is with certain skeletal muscles. When they contract, they're going to press on the veins that are right up next to them. And that's going to help push that blood through the next valve. So with muscles contract, we're squeezing the veins and pushing that blood through the next valve. That is my skeletal muscle pump. We're pumping the blood a little bit closer to the heart. And then our other system for venous return is the respiratory pump. And this is during inhalation. Our diaphragm is the big driver in our respiratory pump. It's going to move downward, allowing blood to flow into the decompressed veins and then into the right atrium. So this is like the last little hurrah as we're trying to get blood back to the heart. We have our respiratory pump there to help us out with the tail end of that. So here we got a pie chart showing where blood is typically, and this is going to be pretty much at rest. This is where blood is. So we want to know that we've got about 64% of our blood at rest is in somewhere in our venous system. In some of the veins, venules, 64%. All right, pulse. So your pulse is the pressure in your arteries going up briefly as your heart pushes out more blood to keep circulation going. We want to note that normal pulse rates are between 60 and 100 beats per minute. And just a reminder from our heart chapter previously, tachycardia is anything above 100, and bradycardia is anything below 60 beats per minute. And a little picture here just showing us some of the places you can get someone's pulse pretty readily. The radial, of course, and the carotid are probably the most commonly used areas to assess the pulse. Now, baroreceptors is something I really want to stress. This is something the nursing department really asked me to lean into here. Baroreceptors, sensors that we locate specifically in our carotid sinus and in our aortic arch. So our carotid sinus and aortic arch, they sense blood pressure and relay that information to the brain, so then the brain can make the proper adjustments that it needs to get our blood pressure back within a desirable range. So carotid sinus, aortic arch, we're measuring blood pressure with baroreceptors. All right, so some of the major arteries and their branches. So from the heart, when we leave the heart, we're of course flowing out of the left ventricle is where we're going to start, and that's going to push us into the aorta. We get pushed through the aortic valve, or that left semilunar valve, into the aorta. Aorta is the largest diameter artery. The attachment point to the heart itself we refer to as the aortic root. That's just where my aorta and my heart come together. And then we have the aortic sinuses, and this is where our left and right coronary arteries arise. Remember, our left and right coronary arteries immediately turn around and supply the heart muscle itself. So that's kind of the first thing we do, is go ahead and supply the heart with fresh blood so we can keep it pumping, because it's kind of the driving force behind this whole system. So we can see in our picture right there at our aortic root is also where we're going to get the coronary arteries, or I'm sorry, the coronary sinuses. The aortic sinuses, where our coronary arteries arise from. All right, so our aorta comes out as the ascending aorta, and it goes up just a tiny little bit, then it branches over and becomes our aortic arch. We have three major vessels that arise from our aortic arch. We got our brachiocephalic trunk, which is going to just branch off just a little bit before it splits to become my right common carotid artery and my right subclavian artery. Common carotid going up to the head, subclavian passing under the clavicle to head down the arm. Then the other two branches are the left common carotid and the left subclavian. So the brachiocephalic trunk there is really just a segue to help get us away from the carotid area around the heart. We're going to use that to branch out a little bit, and then we're going to split into my right common and right subclavian. And then, of course, the other two branches are the left common and left subclavian. Little picture for us, kind of showing us all of the branches. So we can see how the brachiocephalic trunk is just that little pinch of an artery there, the first thing coming off the aortic arch. And we see how it juts upward before splitting into the carotid and the subclavian. All right, so let's look at the subclavian. Our subclavian artery, we got a couple of branches that we want to be familiar with before we head down the arm. So part one here, this is before we head down the arm. My subclavian artery gives rise to the vertebral artery, which is easy to spot. It passes through the vertebra, specifically through the transverse foramen of C1 through C7. So all of my cervical vertebra have these transverse foramen, and my vertebral artery passes through all of them. In the cranial cavity, the vertebral arteries unite to form the basilar artery. So our basilar artery is going to supply major parts of the brain, specifically the pons, the midbrain, and the cerebellum. Then it's going to split into two posterior cerebral arteries. These are going to supply the cerebrum. It's in the name, posterior cerebral, supplying the cerebrum. And they also help form part of that circle of Willis, also known as the cerebral arterial circle. And our circle of Willis cerebral arterial circle is going to connect the vertebral artery and the internal artery systems of the brain itself, and act as almost an anastomosis itself in giving us an alternative blood flow to those various parts of the brain. So we can see here in a dissection how the circle of Willis is actually put together, and where the basilar arteries and the posterior cerebral arteries come into play. This is not a picture I hold you accountable for, but I want you to see the circle that gets formed by the circle of Willis, and how that is going to be deep in the brain to help supply all of the many parts of our brain. All right, so still on the subclavian artery. So we gave rise to the vertebral artery first, and then we give rise to the thyrocervical axis. So if you put your finger on your thyroid gland, and where really your thyroid gland meets your neck, it's at the bottom of your throat in the front. And so it's going to supply pretty much everything in that area, which is my thyroid, my parathyroid, the larynx, the pharynx, the trachea, and the esophagus. So everything in that region gets supplied by the thyrocervical axis, at least in part. Then we have our costocervical artery, which is going to supply all the muscles in the neck, back, and thoracic wall. So this is kind of on the opposite side, where my thoracocervical axis is in the front, my costocervical is kind of in the back. From here, our subclavian artery is going to head on down the arm, and we will come back to that momentarily, but these are the branches from my subclavian before it heads down the arm. So I got my vertebral artery, my thoracocervical axis, and my costocervical artery. So we can put it all on one slide and see exactly what our subclavian artery is branching into before it heads down the arm, what it supplies, or what it becomes in the case of the vertebral artery, because it continues on into several other vessels before it is finished. All right, arteries of the brain, head, and neck. So my left and right common carotid arteries are going to split into my internal and my external arteries. So my internal artery is going to disappear up into my head, up into my brain area, and help supply parts of it. My external carotid is going to stay outside of the brain and kind of supply all of the superficial structures of my face and the surrounding area. So my external carotid, we got 5 major branches. Pretty easy here. Superior thyroid, supplying the thyroid gland. The lingual artery, supplying the tongue. Lingual means tongue from chapter 1. Facial artery, supplying all the parts of our face. Occipital artery, the scalp at the back of our head. And then the posterior auricular literally means behind the ear, the artery behind the ear. So this is going to be the ear and the scalp over the ear. And then our external carotid actually terminates by splitting into the maxillary artery, which is going to go to my upper teeth, my gums, and my jaw, and my superficial temporal artery that really goes to the parotid salivary gland. So it's at our temple region, and right under the skin there is where our big major salivary gland is located. So superficial temporal, the parotid salivary gland. Now my internal carotid, first thing we got to know about the internal carotid, this is the major blood supply to the brain. Major blood supply to the brain, internal carotid. 3 major branches to it. The ophthalmic artery going to the eyeball itself. Posterior communicating artery forming parts of that circle of Willis. And then my anterior choroid artery going to the choroid plexus of our brain, which hopefully we remember from 168 is what produces cerebrospinal fluid. Remember, your brain and your spinal cord kind of float in cerebrospinal fluid, and all of that gets produced by the choroid plexus, which is supplied by my anterior choroid artery. All right, so here's a picture showing us the arteries of the brain and neck. A lot of this is pretty basic, pretty easy stuff. So if we look at the ophthalmic artery, we can see that right above the eye there. The maxillary artery, we have to follow in a little bit to get to where it's actually labeled at. But if we follow that vessel back out, we can see that vessel goes to the upper teeth. It kind of heads up behind the nose and branches down to hit the upper teeth area for the maxilla. Facial artery is labeled really low, but if we follow that vessel on up, we can see how it does indeed supply the entire face, because it goes all the way up the face. Lingual artery, again, is labeled low, but if we follow that up, that's going to end up right at our tongue. Superior thyroid, we just talked about all of things that are around that thyroid gland, thyroid, parathyroid, trachea, esophagus, etc. And then down at the bottom is my common carotid. I'm going to come back to that in a second. And then at the very bottom, the brachiocephalic trunk, that was one of those branches off of our aortic arch. On the top of the left side, I've got my superficial temporal at the temporal region. Remember, that's the one that goes to my parotid gland. The posterior auricular going to behind the ear. I've got my occipital, that's an easy one at the back of the head. Now the basilar artery is deep in there, and I'm going to come back to it in a second as well as my carotid stuff here. What I want to get down to is the vertebral artery. So we can see how the vertebral artery branches off of the subclavian, passes up through all of my cervical vertebra, then does this crazy juke turn up through the foramen magnum to get into my brain area. Once it's up there, now it's the basilar artery. It's the same vessel, but as it passes through the vertebra, it is the vertebral artery. When it gets up into the brain area, now it's the basilar artery. All right, so let's drop back down to the vertebral artery. We can see it passing through the vertebra. Beneath that, we have our thyrocervical trunk. Branching off the subclavian, comes up and splits almost immediately. It looks like it's almost part of the vertebral artery, but it's not. And then the very bottom one is the subclavian artery, about to head down the arm once it passes underneath that clavicle. So back to the common carotid artery. So brachiocephalic trunk coming up, it becomes the common carotid. If we follow the common carotid up, we can see where it splits into my internal carotid and my external carotid. Remember, the external carotid stays externally. So if we follow it up, we see how it supplies all of the features, the face, the head, the back of the head, all of that can get traced back to the external carotid. My internal carotid, if we follow it up, first of all, before we follow it up, we got this swelling at the base of my internal carotid that we call the carotid sinus. So that's an easy way to spot the internal carotid because it has that carotid sinus on it. But if we follow it up, it disappears up into the brain itself, going internally. And I think that's everything. I thought there was one more I needed to come back to. No, I think I hit it with the basilar. All right. Moving on. Arteries of the shoulder and arm. So now we're back at the subclavian artery. Now we're heading down the arm. So it becomes the axillary artery when it passes between the clavicle and the first rib. So subclavian becomes the axillary artery. Our axillary artery is going to supply the axilla or the armpit. It's going to go to the chest wall, the mammary gland, the shoulder joint, pretty much everything in that axilla region or the nearby area. As it heads on down the arm and leaves the axilla, now it becomes the brachial artery. So just be clear on that. My subclavian artery becomes the axillary artery, which becomes the brachial artery as we move through the different parts of the arm. So this is going to supply muscles on the anterior arm. Remember, this is from anatomical position. So our arms are kind of palm up here to be the anterior arm. Our brachial artery is also going to give rise to the deep brachial artery, which is going to slip around the back and supply the triceps muscles on the back of our arms. When we get to the elbow, it's going to split and become the radial and the ulnar arteries. So these are very, pretty similar, pretty straightforward. The ulnar is going to be the flexor and the extensor muscles on the ulnar side of my forearm and wrist. Radials, flexor, and extensors on the radial side of my forearm and wrist. At the wrist, these two arteries join to form a network of vessels that are going to supply the hand, but that's really as far down the arm as we're going to go. So we can see our picture. So we're dropping all the way back to really the right subclavian artery is where we want to start. As we head down the arm, we can see it pass under the clavicle there. That's why we call it subclavian, because it passed it under the clavicle. When we get to the armpit, now it's the axillary. As we get down to the middle of our arm, it becomes the brachial artery. We can see the deep brachial where it branched off and went to the back of the arm. At the elbow, it splits to become my radial and the ulnar. And then down in the hand, you can see how these two vessels come back and unite and give rise to all of the little vessels in our hand itself. All right, so the descending order. So now we finished with the aortic arch, and now we're heading down. So our descending aorta is a lot. It's much longer than the ascending aorta, and it gives rise to a lot of things. And so what we do is we split the descending aorta into the thoracic and the abdominal aorta. So the thoracic aorta is all of the descending aorta above the diaphragm. The abdominal aorta is all of the descending aorta below the diaphragm. So we're using the diaphragm as our split point here. Above the diaphragm, it's the thoracic aorta. Below the diaphragm, it's the abdominal aorta. So with our thoracic aorta, we've got 5 branches. The bronchial artery supplying the bronchi of the lungs. Pericardial artery supplying the pericardium that wraps around the heart. Esophageal artery is supplying the esophagus, mediastinal artery supplying the mediastinum itself, and then the last one is the posterior intercostal artery. Well, this means posterior means in the back, inter means between, costal means ribs. So this is on your back in between the ribs is where we're going to find this. So it's supplying pretty much the thoracic wall on your back, on that posterior surface of your body. As we head down below the diaphragm, we get to the abdominal aorta. And so this is 9 branches. First up is the celiac artery. I prefer celiac trunk because it's a little tiny vessel coming off the abdominal aorta that immediately branches into 3 other vessels. But it's just that little bit and its branches that we call the celiac trunk. So that's just easier for me. You can call it celiac artery or celiac trunk. It doesn't matter. But it's going to give rise to the left gastric artery, the splenic artery, and the hepatic artery. Then we've got our phrenic artery. Phrenic means diaphragm, so these are the vessels that are going to supply the diaphragm. My superior mesenteric arteries. Mesenteric means intestines. So this is going to go to the upper part of my intestines, which is mostly my small intestines, a little bit of the large intestines, but it's really more geared towards my small intestines. As we head on down, we'll hit the suprarenal arteries going to the adrenal glands. Remember, the adrenal glands sit on top of the kidneys, which is why we say suprarenal. Supra is just short for superior or above. Renal, of course, is kidney. So above the kidney artery, that's where we're going to find our adrenal glands. Renal arteries going to the kidneys themselves. Gonadal arteries going to the ovaries or testes, just depending. The inferior mesenteric, so my lower intestines here. So that's going to be my large intestines. My lumbar arteries come in pairs, and so they're easy to spot on each side. And then my middle sacral kind of splits right down the middle when my abdominal aorta becomes my iliac arteries on each side. So now we can see in our picture, remember this is below the diaphragm. So our first vessel on the top is my inferior phrenic, which just means below the diaphragm. And we can see how these vessels are geared going upwards because they're going to the diaphragm that sits above it. The diaphragm's just not in this picture. We get a little piece of it wrapped around, but not really in correlation to the vessels. So beneath our inferior phrenic, we got our aortic hiatus. So this is just the hole in the diaphragm that our aorta is going to pass through. Beneath that, I've got my superior, middle, and inferior suprarenal artery. So we can see our adrenal gland sitting on top of the kidney and how we have the 3 different vessels going to that. Beneath that, I've got my superior mesenteric artery going to my small intestines. Beneath that, the renal artery, of course, going to the kidney. Then I've got my long, dangly gonadal artery. Again, the lumbar arteries are in pairs, one on each side of the aorta, so really easy to spot. Beneath that, I've got my inferior mesenteric artery. And now as we head down past our inferior mesenteric artery, our abdominal aorta splits, and it becomes my common iliac artery. And it's going to start to head down or point down towards each leg. So I've got one going down my right leg, one going down the left leg. In between the two is my median sacral or middle sacral artery right down the middle. So if I head down either one of my common iliac arteries, we get just a little ways down and it splits again and gives rise to my internal iliac artery, which is going to turn and go towards the genital region. My external iliac heads on down the leg itself. So here we have it written out for us. Common iliac splits almost immediately into my internal iliac versus my external iliac. Now with my internal iliac, I've got 6 branches. I've got my iliolumbar, so it's going to the ilium, which is your big hip bone, and some of the lower back muscles. I've got my superior and inferior gluteal arteries going to the skin of the butt and some of the muscles in your butt. My internal pudendal going to the external genitalia, so pudendal means genitalia. I've got my superior and inferior vesical artery going to the bladder and prostate. I've got my middle rectal going to the rectum, and then the uterine going to the uterus and or the vagina. Our internal iliac artery becomes the obturator artery as it passes through the obturator foramen. My external iliac is the main blood supply to the legs. We absolutely need to know that. External iliac, main blood supply to the legs. It has two branches. I've got my inferior epigastric artery, supplying the muscles and skin in the lower abdominal wall. And then I have my deep circumflex iliac artery, supplying the iliac bone. My external iliac artery becomes the femoral artery as it continues to descend down the leg. So just like in our arm, our subclavian artery became our axillary artery, which became our brachial artery. The same thing is going to happen with my external iliac. It's going to become my femoral artery and then eventually my popliteal artery as we head on down the leg. So my femoral artery, 5 branches. I've got my superficial circumflex iliac artery going to the lymph nodes and skin of the groin. I've got a lateral femoral cutaneous going to the lateral thigh area, so that's way off to the side. My superficial epigastric going to the skin of the lower abdominal wall. My superficial and deep external pudendal going to the skin of the external genitalia. I've got my deep femoral artery, which, just for note, is the largest branch of all of these from my femoral artery, going to the hip joint and to the muscles of the thigh. And then I got my genicular arteries, which are around the knee. They kind of go on each side of the knee. When my femoral artery reaches the popliteal fossa, we now call it the popliteal artery. And so we can start to see some of that as we head down the leg. So starting at the very top on the anterior view is what we'll look at here. As we head down, we can immediately see where it splits into my external iliac and my internal iliac. Internal is heading off towards the genitalia. External is the major vessel that's going to head on down out of the pelvis down the leg. And as it heads down the leg, we can see our circumflex femoral artery. It gets its name because it completely encircles the neck of the femur. We can see how it wraps all the way around. It does a circumference around the femur. That's why we call it the circumflex femoral artery. As we head on down, we can see it gives rise to the lateral femoral cutaneous artery on the side. And then our femoral artery coming down the middle of our thigh. Our deep femoral artery kind of tucked away behind that femur bone. But if we head on down the femoral artery, at the knee it becomes the popliteal artery, and then we get our genicular arteries on each side, just helping to supply the knee. As we go on down, it's going to become my anterior and posterior tibial artery. We also have a fibular artery branching off there. If we look over at the posterior view, we can see where the fibular artery pops out at. And then down into the foot, I've got my medial plantar on the medial aspect of the foot. I've got my lateral plantar on the lateral aspect of the foot. And then I have dorsalis pedis, which is kind of the top of the foot. All right, so my popliteal artery, backing up just a little bit here, supplies the knee. As it leaves the popliteal fossa, it becomes my anterior tibial and my posterior tibial arteries. Anterior tib supplying the anterior and lateral regions of the leg. In the foot, it's going to become dorsalis pedis, supplying some of the instep and the toes. My posterior tib, the larger of the branches, supplies skin and muscles and other tissues of the leg. It is going to split into 3 vessels. So my posterior tibial gives rise to 3 vessels. My medial plantar, lateral plantar going to each side of the foot respectively. And then my fibular, which is the largest branch of the posterior tibial artery, contributing to the anastomoses of the ankle itself. So back to our picture. Now we can see the tibs, posterior and anterior tibial, the fibular artery, and all of those foot arteries that we just talked about. So now that we've done the arteries, we've got to look at some of these veins. And with the arteries, we started at the heart and worked our way out. With the veins, we're going to start out and work our way back towards the heart. So typically veins are named after the artery they're paired with. So if you know the artery, you know the name. There are a few exceptions, though, that we need to go over here. So besides the pulmonary veins from all other parts of the body converge into 2 major pathways. We are either going to do the superior vena cava, which is the major pathway that is going to drain my upper region, my head, my neck, my trunk, my arms. All of that are going to drain into the superior vena cava. Or my inferior vena cava, which is going to be my lower regions, which is my abdomen, my pelvis, and my legs. all of that is going to drain into the inferior vena cava, and they both dump back into the right atria itself. So, veins of the head. So we can see in our picture immediately, if we start on the right-hand side, the superior ophthalmic vein was just like the superior ophthalmic artery. The facial vein is exactly like the facial artery, superior thyroid. But then we get down to the jugular vein. So that is something new. What we need to understand here with the veins, the exception with the head, is that we have jugular veins that are paired with our carotid arteries. So they are each other's yin to yang, where we've got the facial vein and the facial artery. With these two, we've got the jugular veins and the carotid arteries. So they are each other's opposites here. So there's no such thing as a jugular artery. There's no such thing as a carotid vein. Jugular and carotid go together. So you need to put that into your brain. Most of the arteries we learned have the veins. So we got the dural sinuses draining blood from the brain itself. There it says the jugular vein travels with the carotid artery. And just like our carotid, our jugular vein has an internal and an external branch. We also have, the other exception is two brachiocephalic veins, where we just had one brachiocephalic artery. These two brachiocephalic veins are going to join together to form the superior vena cava that's going to lean back towards the heart. So my external jugular veins are going to drain the face, the scalp, and the neck. Then they're going to drain into my right and left subclavian veins on each side of the body. My internal jugular vein is going to drain parts of the brain, the deeper parts of the face and the neck, and it's going to merge with the subclavian veins to form the brachiocephalic veins on each side. So the brachiocephalic veins are formed from my internal jugular and my subclavian veins. So my external jugular drains right back into the subclavian. External and internal jugular do not unite. So we can see in the picture the dural sinuses kind of deep in the brain there, helping drain some of that region. And then the only other new thing that we really need to look at is the jugular vein. So we can see my external jugular vein clearly on the outsides here versus my internal jugular, the bigger one, and how it goes up and disappears up into the head and eventually becomes those dural sinuses. So let's make note of that. All right, veins of the arm. So we're starting way out at the distal end of our arms here with our hands. And our forearms, we've got our radial and ulnar veins draining each side of the arm respectively. They're going to merge back together to form the brachial veins. But we do have a few new veins here that we need to be familiar with. We've got the basilic vein, which is going to drain the palm and wrist on the ulnar side. We also have the cephalic vein, draining the palm and wrist on the radial side. And then connecting the two is the median cubital vein. So we have three new veins, basilic on one side, cephalic on the other, and connecting the two right at the elbow is my median cubital vein. And this is the vein that they use for venipuncture. So when someone draws blood, that's what they're trying to hit. They're trying to find that median cubital vein in the crook of our elbow. And they're going to drain back up and join the axillary vein. Our axillary vein is going to become the subclavian vein as it leaves the shoulder, and then it's going to unite with that internal jugular vein to become the brachiocephalic vein on each side. So we can see in our pictures, it's pretty straightforward. I want to pull our attention here over to the anterior picture on the left-hand side and immediately grab that cephalic vein. So we can see how that cephalic vein runs up on the radial side, our basilic vein on the ulnar side, and then connecting the two is my median cubital vein. Median cubital vein. All right, so veins from the thoracic wall. There's only one that I'm really going to worry about here, and that is the azygos vein. We can clearly see it from the arrow here, and it's a nice thick vein that runs along our vertebra all the way up our thoracic spine. So we can see how it branches off and helps drain all of that thoracic cavity. All right, abdominal visceral veins. So most of the veins go right back to the heart so we can reoxygenate it as quickly as we can. But some of the veins we have to take a little extra precaution with, especially the veins that drain our abdominal viscera. And by that, I mean my digestive organs. So these organs first, before they can get back to the heart, they've got to go through the hepatic portal system. To get there, all of these veins are going to drain into our hepatic portal vein, which is going to take us to the liver. Once blood arrives at the liver, it's going to enter the hepatic sinusoids, which is kind of like a pathway that the blood has to follow. We call this pathway the hepatic portal system. These are the veins of the hepatic portal system. My left and right gastric vein from the stomach, my superior and my inferior mesenteric veins from my intestines, plus the splenic vein from the spleen and the pancreas. We single out these veins specifically because this is where most of our digestion is occurring. So at the bottom here, most of the blood in the hepatic portal system is oxygen rich. We've already given away our oxygen. We've picked up our carbon dioxide, but we're also picking up nutrients because these are our digestive organs. This is where we're getting nutrients from. But as we pick up these nutrients, we almost are always also picking up bacteria that is just in some of the crap that we eat. So the liver cleans and regulates the body by monitoring all of this stuff. I want to pull our attention down to number 5 here. This is the important one for the hepatic portal system, the Kupffer cells. Kupffer cells. So these line the hepatic sinusoids. Remember, the hepatic sinusoids are the pathway through the liver that blood has to go through. And all along this pathway, we have these Kupffer cells, and their job is to phagocytize bacteria and microorganisms. Their job is to pull out any of the stuff, any of the bacteria, any of the microbes that's not supposed to be in our blood. They're going to eat it, get rid of it, break it down, kill it before that blood gets back to our heart. Because that's the last thing we want to do, is send bacteria and microbe-infested blood back immediately to our heart. We have to clean it first so we don't damage our heart, and that happens through the Kupffer cells of our hepatic portal system. Once it makes its way through the hepatic sinusoids, blood's going to exit the liver through the hepatic vein, which is going to dump back into the inferior vena cava. So here we can see the hepatic portal system itself. This is not a picture I hold you accountable for, but I wanted you to be familiar with the hepatic portal system so you have an idea of what we're talking about as we drain these all of these organs, these digestive organs, and how it all gets pushed up into the liver where it gets cleaned before it exits and heads back to the heart from there. So we got some deep veins of the leg. I've got my anterior and posterior tibial veins draining the lower leg on each side. As we make our way back towards the heart, they're going to merge together to become the popliteal vein, which is going to drain the knee. Then it becomes the femoral vein as we get back to the thigh. And then it becomes my external iliac vein as we get up into the pelvis. Some of the superficial veins of the leg, we have 2 new veins here. I've got my small saphenous vein beginning in the lateral aspect of my foot. It's going to travel up my leg and join up at the popliteal vein itself. Then I've got my great saphenous vein, which is the longest vein in the body. It's going to originate in the medial portion of the foot and run all the way up to the thigh, where there it's going to join the femoral vein. So a nice big long vein running all the way up the leg. I've got my internal iliac veins helping to drain my reproductive organs and urinary organs. They're going to unite on each side with my left and right external iliac veins to form my common iliac vein as it leaves the pelvis on each side. These 2 common iliac veins are going to merge together to form my inferior vena cava at about L5. And then, of course, the inferior vena cava returns blood back to the right atria. So here we can see that in a picture. All this is very similar to what we did with the arterial side of things. I want to pull our attention first to the right-hand side of the picture near the bottom. There we have the small saphenous vein. So that's a new vein for us. And we see how it just moves kind of up that lateral aspect of our leg. And then on the inside, kind of in the middle of the picture, we've got the great saphenous vein just above the knee on each side, but we can follow that vein all the way down. We see where it starts at the medial aspect of our foot, and it runs all the way up the medial part of our leg, all the way up to the hip, before it joins back up with our femoral vein. All right, arteriosclerosis versus atherosclerosis for a little pathology. So Arteriosclerosis is just a hardening of our vessels. They lose some of that elasticity, so they're not managing the blood as well. That's also going to hinder how much they can vasoconstrict and vasodilate, which is going to have an impact on blood pressure. Atherosclerosis is where we get fatty buildup, or plaquing on the inside of our walls, and a lot of times that's going to hinder flow, and if it gets bad enough, it can cause some major issues, especially if pieces of that start to break off and clog up other veins that are, or other vessels that are as important. Varicose veins, this is pretty much caused by weak or damaged valves, especially as we age. Our valves kind of lose some of the gumption that they once had, and they just wear out over time. And once they start wearing out, that allows blood to kind of flow backwards, back down our legs against gravity. This is going to cause those veins to bulge out and twist some. That is what a varicose vein is. Most common in the legs, especially as we get older. Renal artery disease. This is caused by plaquing buildup in the renal artery itself, causing a reduction in the blood flow to the kidney. So the kidney gets 20% of your blood, a fifth of your blood. Every time your heart contracts, a fifth of that blood, 20%, gets pushed into the kidneys for additional cleaning. We're really helping to clean out a lot of the plasma in the kidneys. And when we start hindering how well we can clean the blood, that's going to cause all kinds of problems later on. This can result in hypertension and or kidney failure if this plaquing gets bad. If this renal artery disease goes unchecked, it can cause major complications. So we can see in the picture to the right on the bottom, we got a little arrow there showing how the vessel is not showing up anymore because of the plaque that's built up inside of it. And then we have the aortic aneurysm. So this happens when we get a weakness in the wall of our aorta and blood starts to accumulate there, and the weakness in the wall allows the pressure to balloon out. So our aorta just kind of moves out laterally on all sides and balloons out. And if the pressure gets bad enough, then the aorta can rupture, and that is bad news. That is definitely life-threatening. There's not a whole lot they can do for a ruptured aorta. You're going to bleed out internally in minutes. It's just bad all the way around. So some of the factors to be on the lookout for aortic aneurysms: being a man, smoking, high blood pressure, all of these are major factors that lead to it. And now it can't be in your thoracic region, but I believe it's much more common in the abdominal region. All of our pictures here are in the abdominal region. So if we started the picture on the far left-hand side, this one's a little tough to see, but we've added in these little white arrows that kind of outline the edges of our abdominal aorta where it is swollen. In the middle picture, it's much more obvious to see. On the far picture on the right-hand side, in the bottom corner, we can see the R marking that was the right side of the patient. It's on the patient's left side at about the level of L4, L3, L2. We can see the aorta bulging out on that side specifically. All right, know your vessels. Be able to identify them by sight. Absolutely know what they supply or what they drain. And then all of the other little nitty-gritty interesting facts that we talked about in this PowerPoint. Good luck.